So this is a good slide to put a star next to, and I have to give credit. A great number of these slides were prepared by a transition specialist out of North Carolina, and I just did a little bit of tweaking, but there needs to be a thoughtful, planned, coordinated approach. Transition of healthcare should occur during time of disease stability, and I think the worst case scenario is when people transition from a pediatric healthcare provider to an adult healthcare provider during time of health crisis. That is the worst case scenario, particularly if someone is in the hospital. Suddenly, parents are hearing, well, the pediatricians can't take care of my child anymore. Adult healthcare providers unfamiliar with the patient, unfamiliar with the patient's developmental diagnosis, are suddenly tasked with providing health care. And so you really optimally want to have healthcare transition occur during disease stability. So that's why that's highlighted. In an ideal world, it'd be nice if the transferring and receiving healthcare teams meet together with the patient and family. We don't do that at the Cleveland Clinic. We don't really have organized transition clinics for people with developmental disability. And, I know that that's something that a number of us at times have started to engage in conversation about, have started to talk about. We just haven't gotten traction yet. But, there are centers around the country. They're not many and they're not predominant, where there are transition clinics where adolescents and young adults with complex healthcare needs go during this transition time to plan out their health care. And in those clinics, sometimes you have the pediatric health providers and the adult health providers together in the same conference room, or together with the patient and family, but those are the rarity, and I'm not aware of that happening here in Cleveland. Part of healthcare transition is encouraging self-management of health by the adolescent, teaching the core skills required. And so it's not just a passive event that occurs, and healthcare transition isn't just finding an adult physician, a physician who provides care to adults. It's also seeing what it takes to optimize the capacity of adolescents and young adults with special healthcare needs to do as much self-management of their health as possible. Let me see. One aspect of healthcare transition is that the same healthcare issues relevant for any adolescent need to be considered also. So we're talking about sexuality, about independence, about safety, about mental health. The same adolescent kind of issues that apply to the general population, of course, apply to adolescents and young adults with special healthcare needs. Sometimes what we what I observe and others observe is that some of the battles of adolescent independence and desire for autonomy and that kind of push-pull that parents, having 3 daughters, I know about all that, push and pull that in terms of, acting maturely one minute and immaturely the next and back and forth. Sometimes those battles for independence and autonomy might be delayed into the 20s is my experience. So, and honestly, we still need to build more institutional support locally for transition. Okay. So I think these slides are informative in terms of looking at different players' perspectives about healthcare transition. And this is a survey that was administered to pediatricians, asking them at what age should transition begin. And as you see, really for the most part, pediatricians who were surveyed did not see any difference in age at which transition should be considered between adolescents with special healthcare needs and adolescents without special healthcare needs. What we find, though, in practicality is still a lot of young adults and even middle-aged adults may be still seeing pediatricians in their 20s and 30s, and transition has not occurred. And so there's been a failure of transition, and that becomes increasingly hazardous as pediatricians, by virtue of their training, are unfamiliar with the conditions of middle age and later age that need to be looked for, prevented, screened for, diagnosed and treated. But still occasionally, I encounter individuals with developmental disabilities well into adulthood who still had been seeing pediatricians. Okay.